Executives of the only hospital system in our region are planning to make a major announcement about where patients with traumatic injuries will receive care.
And we sat down with top executives at Ballad Health to give you insight into months of research guiding the fate of Level 1 trauma centers in the Tri-Cities. Now, a Level 1 trauma center has surgeons and specialists on site around the clock to care for severely injured patients. 2 trauma centers are located in the Tri-Cities, one in Johnson City, the other in Kingsport. A Level 2 trauma center like the one in Bristol has to have specialists on call rather than staffed in the building. Prior to the merger of Ballad Health System and Mountain States Health Alliance, leaders promised there would be a realignment of regional trauma centers.
Jackie DeFusco is in your corner asking questions about changes in Ballad Health services that will impact you and your family.
Yeah, Josh, Sarah, until recently, the 2 major hospital systems in our region, like you said, Mountain States Health Alliance and Wellmont Health System, were fierce competitors. And since they merged together as Ballad Health, they're looking for ways to cut down on duplicate services. Although changes to Level 1 trauma centers have yet to be revealed, Ballad Health executives maintain that plans will not sacrifice the quality of emergency services.
If you go back to what we said at the beginning of the merger discussion, we want to eliminate unnecessary duplication of resources and reinvest those dollars into things that actually create value for the region.
And today, Ballad Health executives preparing to make a major announcement to make good on that promise.
And it'll be a major announcement about a transformation with how we provide care in the region.
For now, withholding details, but promising.
Yeah, I think what's safe to say is we'll have an enhanced regional trauma network that is second to none in the United States.
As competitors,
you would never get us to collaborate on trauma.
That's why the Tri-Cities currently has 2 Level 1 trauma centers, even though major cities like Nashville, serving much larger populations, only have 1.
There is such an oversupply of trauma capacity here that it really has diverted resources away from services that are needed. That's become very clear with the data and the evidence.
They say this realignment of care will help address current problems, like inconsistent physician coverage.
You could be a Level 1 and not provide all of the services consistently that you're supposed to provide. And in fact, there's been circumstances where both the Level 1 trauma centers have failed to do that in the past.
They say it will also help the hospital network reach its full potential when it comes to preventative research and outreach.
A very big proportion of our trauma is preventable. And we need to spend more time and resources as a system of care trying to get at the cause of trauma.
But one of the most glaring deficits in care they say this will address is the current lack of a pediatric trauma center in the region.
Treating illness is more than just treating a disease or an illness. It's being there for the whole family and providing the full spectrum of support for the family.
They say current facilities aren't doing that, with the nearest pediatric trauma center an hour and a half away.
So this is not something that's creating a stir inside the medical community. In fact, exactly the opposite. It's the way we've really always wanted to do business.
And with the care of thousands at stake, executives assuring that all of the board's decisions started with this question.
What are the needs of the people, and how do you match those needs with the resources you're going to provide?
And something else you may be wondering about, Ballad Health leaders say they plan to also reduce helicopter response. They say there'll be just 1 service ultimately with multiple units.
Jackie, thanks. Now, it's important to note whatever changes are made will not happen overnight. Ballad Health leaders tell us these changes will take about a year to implement.